Critics of psychiatry are often portrayed as these kind of anti-science, fringe figures that don't belong in the mainstream discussion of the quote science of psychiatry. Probably the most notable example would be someone like Thomas Szasz, who we've discussed on this channel before, who spent his whole career basically warring against a field that he believed to be a pseudoscience, despite being a medical doctor himself and a trained psychiatrist that did provide therapy to his clients, despite his criticisms of modern psychiatry and the disease model that it promotes. But did you know that one of the most famous psychologists of all time basically made similar arguments to people like Szasz and criticisms of this emphasis on, quote, mental illness and the diagnostic model? Who am I talking about? Well, none other than Carl Jung. Did you know that he actually believed diagnosis to be of little, if any, value whatsoever, and de-emphasized it almost completely? We're going to talk about what he had to say all the way back in the 50s from his book, The Practice of Psychotherapy. We're just going to pick out two excerpts that relate to what I've been saying here, that summarize Jung's beliefs about this, that, again, when people, these quote fringe figures in the modern day, make these same kind of arguments, they're seen as somehow not legitimate. But it's hard to get a more authoritative mainstream figure than Jung. He was saying basically the same thing close to a century ago. It is generally assumed in medical circles that the examination of the patient should lead to the diagnosis of his illness, so far as this is possible at all, and that with the establishment of the diagnosis, an important decision has been arrived at as regards prognosis and therapy. Psychotherapy forms a startling exception to this rule. The diagnosis is a highly irrelevant affair since, apart from affixing a more or less lucky label to a neurotic condition, nothing is gained by it, least of all as regards prognosis and therapy. In flagrant contrast to the rest of medicine, where a definite diagnosis is often, as it were, logically followed by a specific therapy and a more or less certain prognosis, the diagnosis of any particular psychoneurosis means at most that some form of therapy is indicated. As to the prognosis, this is in the highest degree independent of the diagnosis. Nor should we gloss over the fact that the classification of the neuroses is very unsatisfactory, and that for this reason alone, a specific diagnosis seldom means anything real. In general, it is enough to diagnose a psychoneurosis as distinct from some organic disturbance. The word means no more than that. I have in the course of years accustomed myself wholly to disregard the diagnosing of specific neuroses, and I have sometimes found myself in a quandary when some word addict urged me to hand him a specific diagnosis. The Greco-Latin compounds needed for this still seem to have a not inconsiderable market value and are occasionally indispensable for that reason. The sonorous diagnosis of neuroses, secundum ordinum, is just a facade. It is not the psychotherapist's real diagnosis. His establishment of certain facts might conceivably be called diagnosis, though it is psychological rather than medical in character. Nor is it meant to be communicated for reasons of discretion and also on account of the subsequent therapy. He usually keeps it to himself. The facts so established are simply perceptions indicating the direction the therapy is to take. They can hardly be reproduced in the sort of Latin terminology that sounds scientific, but there are, on the other hand, expressions of ordinary speech which adequately describe the essential psychotherapeutic facts. The point is, we are not dealing with clinical diseases, but with psychological ones. There you have it. It might be surprising to hear that from someone like Jung, but is that much different than something that Thomas Szasz would say? Just to summarize his points here, that as I and many others have done in the past, we draw this very clear distinction that psychiatry attempts to muddy, these two distinct realms of medicine and psychology. And that medicine, the act of treating physiological diseases, lesions in the body, is in a completely different universe to that of the kind of problems that a psychologist or a therapist is trying to address. The only reason for medicine to be involved is, as I've said before, simply to rule out any organic disturbance. As Jung says, that's all that is needed really to justify the therapeutic exploration. Okay, have we first ruled out that there's no medical issue, underlying medical issue that may be related to what the person is experiencing? Once that's ruled out, okay, we can proceed with the psychological exploration. So that's really the only place that, quote, medicine, only role it really needs to play, just to simply rule out that stuff. And as I've said before, this is why psychiatry doesn't really have much of a reason to exist. Because if there's a suspicion that there's something physiologically wrong with someone's brain, well, that's within the realm, the jurisdiction of neurology, not psychiatry. Neurologists deal with issues, pathologies of the nervous system. So if there is a brain issue, tumor, something to do with related to epilepsy, Parkinson's, these things that affect the nervous system, a neurologist can determine that. But once that stuff is ruled out and you're given a clean bill of health, then that's really all we need. So there's no underlying medical issue that we've identified. So we can just begin to do the psychological exploration. But it's far less invasive and is not designed or assumed to be curing or treating some, quote, disease. At best, we just say that, yeah, you have a complaint, you're unhappy in some aspect of life, and you wish to better understand it in an attempt to hopefully either change it or come to terms with it, accept what it is, and live with it. Let me share one other excerpt that comes only about a page after the one I shared, where Jung just reiterates and builds upon these ideas a bit further. Just as a sure diagnosis is desirable and a thing to be aimed at in medicine, so, conversely, it will profit the psychotherapist to know as little as possible about specific diagnoses. It is enough if he is reasonably sure of the differential diagnosis between organic and psychic, and if he knows what a genuine melancholy is and what it can mean. Generally speaking, the less the psychotherapist knows in advance, the better the chances for the treatment. Nothing is more deleterious than a routine understanding of everything. We have now established that the anamnesis appears more than usually suspect to the psychotherapist, and that clinical diagnosis is, for his purposes, well nigh meaningless. Finally, the therapy itself shows the greatest imaginable departures from the views commonly accepted in medicine. There are numerous physical diseases where the diagnosis also lays down the lines for a specific treatment. A given disease cannot be treated just anyhow, but for the psychoneuroses, the only valid principle is that their treatment must be psychological. In this respect, there is any number of methods, rules, prescriptions, views, and doctrines. And the remarkable thing is that any given therapeutic procedure in any given neurosis can have the desired result. The various psychotherapeutic dogmas about which such a great fuss is made do not, therefore, amount to very much in the end. Every psychotherapist who knows his job will, consciously or unconsciously, theory notwithstanding, ring all the changes that do not figure in his own theory. He will occasionally use suggestion to which he is opposed on principle. There is no getting round Freud's or Adler's or anybody else's point of view. Every psychotherapist not only has his own method, he himself is that method. Ars requirit totum hominum, says an old master. The great healing factor in psychotherapy is the doctor's personality, which is something not given at the start. It represents his performance at its highest and not a doctrinaire blueprint. Theories are to be avoided, except as mere auxiliaries. So again, Jung de-emphasizes the importance of diagnosis, and as I've said in previous videos, argues that if anything, it gets in the way, and we be better off not knowing. I spoke about in a different video that if someone comes to me and tells me they have, quote, ADHD or they have depression, they've got a diagnosis, that really is just this unnecessary barrier to me understanding who you are as an individual and how you came to feel this way, how you came to struggle in this way, which the diagnosis itself can't answer. So it's just a distraction, really, at best. And then another point that Jung makes later on is that, which I could perhaps make another entirely different video on, but this question of the modality. A lot of people get hung up when they're trying to decide on a therapist. They're focused on, okay, what modality do they provide or work with, whether it's CBT or psychodynamic or ACT, DBT, all these different methods, as if that is the most important thing to filter for. But as Jung describes, given just how unique the process is and that the two people doing it, their combination, their interaction can't be replicated. And so the therapist, whatever their modality happens to be, they're going to infuse it with their own style due to their personality and the way they approach the process itself. So two people doing CBT or psychodynamic, it could look very different based on who the people are. There's some research that suggests this, that you're better off, whatever the modality, choosing someone that you're comfortable with and that you feel there's a connection with and you can develop a relationship. And relationship really, as I've said before, is fundamentally what therapy is. It's a relationship via which you can gain a greater understanding of yourself that can catalyze changes you want to make. But you can have the best therapist in the world and they can be the most educated and well-versed in a particular modality. But if you don't feel comfortable being vulnerable around them, what use is it? Doesn't really matter. So that's why I think, again, Jung is emphasizing here that the therapist is the therapy in a way. And so how you feel around the person is going to tell you something very important about whether this has potential. Okay, I think we can leave it there. And again, you might have been surprised that Jung, as famous as he is, was not really a fan of what has become the mainstream model, that we just accept at face value now that all these diagnoses exist and everyone has to bow to the DSM that defines normality and abnormality. But Jung, one of the most famous psychologists of all time, put very little weight on that stuff at all. Okay, till next time, thanks.